My topic is prevalence of ankle instability in football players in Kolhapur city. This research studies investigations of the prevalence of ankle instability among football players in Kolhapur city, specifically focusing on both male and female football players. It provides valuable insights into the incidence of functional and chronic ankle instability in this population, particularly within the context of football players who are at a high risk due to the nature of the sports. Okay, the key findings for this study was the prevalence of ankle instability. Overall, 62.5% of the football players studied reported ankle instability with a higher prevalence in females compared to males. Females had more positive results in both anterior and posterior drawer tests. The ankle joint functional assessment tool was the scale we used to assess the ankle instability. This outcome measures gave us a study revealed that 75% of female participants and 36% of male participants exhibited signs of ankle instability. Nextly, we also take a history of ankle sprain. A higher percentage of females had a history of ankle sprain compared to males. This may contribute to a higher rate of instability seen in female players. Age and experience. The mean number of years spent playing football players was higher in those with the ankle instability. The study found that females are more prone to the ankle instability, possibly due to factors like increased joint laxity, greater range of motion, and differences in neuromuscular control between genders. Females tend to have a larger tibial varum and more calcaneum eversion, which may predispose them to injury. Visual analog scale. On visual analog scale, the mean score for the females was higher compared to males, indicating that females reported more pain or discomfort related to ankle instability. Conclusion of our study. Conclusion. The study concluded that ankle instability is common among football players with higher prevalence observed in females compared to males. The finding highlights the importance of preventive measures, rehabilitations, and effective management of the ankle injuries in athletes, particularly in football players who are more prone to these types of injuries. Further studies could explore further preventive strategies such as neuromuscular training and proper footwear to reduce the incidence of ankle instability in football players. Implication. The research could help inform clinical practice for treating and preventing ankle instability in football players, especially in Kolhapur city. The higher prevalence in females warrants focused attention on gender-specific interventions. Additionally, the study emphasizes on the relationship between experience, history of ankle sprain and instability suggests the earlier interventions and proper management could help mitigate long-term issues for the athletes.